Hi, my name is Dr. David Kulla with Synergy Wellness, Chiropractic and Physical Therapy. Today, if you suffer from a torn meniscus in the knee, you're going to want to watch this video. We're going to do a new innovative treatment for meniscus tears in the knee. Oftentimes, people that have meniscus tears, oftentimes it's not symptomatic, and it can get worse with a knee injury or a slip or a fall. It's a really good way to make a torn meniscus even worse or tear it even more, okay? And Evelyn here, we're using her as an example. She's had plenty of falls. You're a little accident prone, right, Evelyn?
Yes.
We've been seeing her on and on for about 20 years for, gosh, so many different injuries. But she is dealing with a lot of pain and swelling from a torn meniscus in the knee. So we're going to do something new called cold laser therapy, also called low-level laser therapy. The beauty of this is non-invasive, it's safe, it's inexpensive, and it's extremely effective. You can't go wrong with those. Now, you don't feel anything, right, Evelyn?
No.
Okay. It'll also help increase mitochondrial activity, so that speeds up the healing process, and it makes the cell wall more permeable, allowing fluid inflammation to leave the cell wall and nutrients to pour right in, just speeding this recovery time up. We have lasers in the office. We also have rental lasers that we offer. So you can come in, pick up a rental, we show you how to use it, take it home for a few days or even a week or two, depending on what the injury is. Now, meniscus, some of them can be tricky. So you have an anterior horn of the meniscus and the posterior horn of the meniscus. When you tear the posterior horn, it's often more symptomatic and a little bit more difficult to deal with than an anterior horn meniscus tear. Now, if the tear is broad-based, it goes from the anterior horn all the way to the posterior horn, then obviously that's a pretty big tear and that's going to be a little bit more symptomatic. So you want to limit your trauma to the knee, of course, if you have a tear, but you also want to try to avoid orthoscopic knee surgery because statistics show that a majority of the people that have orthoscopic knee surgery are in as much, if not more, pain 5 years after surgery. And how many knee surgeries have you had?
None.
None. Good. So we're just lasering from the meniscus. I got right from the center of it, I'm going to get the anterior horn and the posterior horn of her lateral meniscus. But then don't forget, we also have the medial meniscus on the inside of the knee. And we're going to also do the center, the anterior, and the posterior horn. Right now, you'll see I'm underneath the kneecap. I'm lasering her infrapatellar tendon to just reduce some inflammation there in the whole knee compartment. And depending on the laser, it really depends on the treatment time. So a lot of people ask me, oh, my doctor only did it for a minute. Well, you know, he may have, a minute's a little bit low, but especially to do the whole knee, but he may have a really powerful laser where he can cut the treatment times down to a few minutes. Some people say, I was up there for a half an hour. Well, that laser may be a 25 or a 15 watt laser, so it's a little bit weaker, and the treatment times are just going to be longer. It's not that it's it's a little bit cheaper of a machine, just in the sense that it's treatment times are longer, right? So the longer the treatment times, usually the cheaper the machine. We have like 5 different lasers here. This is a 25 watt laser right here. I have a 50 watt laser. I have 3 15 watt lasers. So we have several of them. Again, we're using a 25 watt laser here on her today. We're going to make sure we touch upon each spot. So you'll see I did the side of the meniscus. We're going to do the front, and then we're going to come from the back as well. And now we're doing the meniscus on the inside as well. And I'm jumping around the knee. Typically I do it in order. I'll go along the knee to keep order. For some reason I just did it a little bit out of order today because I'm talking to you folks and not focusing as much here as my my points here, but you want to keep it in order so you don't lose track of which spots you did, because if you did the same spot over again, you're going to negate the effect of the laser, and you don't want to do that. You don't want to oversaturate the area, but you also don't want to undersaturate it. So I know with this laser here, it's a super pulse laser, I can do about 1.5 minutes in each spot. And we're now on the anterior horn of the lateral meniscus for her, and you'll see right after she stands up, she'll have less pain. It's not going to be 100%, and that's okay. It's our first laser treatment with her, but it will be better. And you can also see the range of motion increasing over time. And then over time, we switch the frequency of the laser, and we use different depths. We're trying to target different depths of tissue. So we might try to target more of the muscle and the ligaments and the tendons on some subsequent following visits. And typically 1 round of laser treatment is about 10 to 15 sessions, and that encompasses 1 round. And it just depends on the injury as to how many sessions we may do. If someone had surgery or is considering surgery, we may do 2 rounds of 10 to 15 sessions to give you an idea. Okay, we're going to go now to the posterior horn of the lateral meniscus for her. So we're just going to come from behind here. Yep. No pain, right? You don't feel anything, do you?
No.
Good. We're just going to hold that right there for a second. And again, we're going to leave it here for about 1.5 minutes. I do have stronger lasers where the treatment times are shorter. But, this isn't a contest to see who has the biggest, baddest, fastest laser. They all work, and they're all very effective, no matter how many wattages we're talking about. Okay, now in about 10 seconds here, we're going to go to the medial meniscus, the posterior horn of the medial meniscus. You ready? Okay. And we've got another 1.5 minutes here. So this laser, all in all, I'm able to treat her knee in 5 minutes. Some lasers may be longer, some may be a little bit less, but it's probably going to be minimum, 2 to 5 minutes, and longer than that. 2 to 5 would be probably the minimum you would expect to treat a knee. Now there are other points I can do along the leg here to help her with the meniscus, but we're just showing you a real, a meniscus approach directly on the meniscus. There are a lot of other points we could go with her because there are some other injuries, but we're not going to get into that today. Just a meniscus tear of the knee. And that's it. If you guys have any questions or comments about cold laser or about meniscus tears, feel free to comment below. I hope you guys got something out of this video. I hope it helped you. And if it has, please subscribe and please give us a thumbs up. Thanks for tuning in.